what is the adherence rate of gout patients in Hong Kong or in the practice on ULT?
It was actually not good, or I can say it's bad. Okay, and normally for compliance problem, it happens everywhere. In patients with hypertension, in patients with diabetes, in patients even with ischemic heart disease, all patients with will have a compliance problem. But for gout and hyperuricemia, these problems would be even worse, because in between attacks, the patients seems to be doing well. They don't really have any symptoms, so they would easily forget about the drugs and then forget about the follow-up appointment. And this makes the adherence very low. So I think in clinical practice might be a few percent who will be really adhered to your treatment. Only a few percent, like at least less than 10%. So this is a very not a very ideal situation. The problems with adherence could be due to many factors. So apart from the patient's factor, so apart from what I have said, the patients might also be worrying about side effect of drugs, because there are many stories about this so-called hypersensitivity syndrome with urate lowering agent, and also the patients would not see any effect if they are not having a gouty attack. So these are some of the patients' factors regarding the low adherence rate. On the other hand, the physician or the treating rheumatologist or the treating physician also have our responsibilities. Many times we don't really treat to target, so we never have any incentive, or never has any treat to target sort of management protocol for the patients to follow. So we just start urate lowering agent without really monitoring the disease and without titrate the drug when the target level is not reached. So also we are also worrying about some of the drug side effect. And many years ago, when I was a medical student, sometimes these books told us that we should never give any urate lowering agent when the patient has an acute attack. But this is becoming obsolete in patient management, because nowadays if you don't give urate lowering agent around the acute attack, then perhaps you would never give a urate lowering agent afterwards, because the patients will either is not coming back, or you will forget about the urate lowering agent. So these are patients and also the physicians' factors regarding to the issues of low compliance or low adherence rate. Of course, the whole management of gouty arthritis or gout are usually focused on the joint itself. So nowadays, because of a lot of data regarding the associated comorbidities or associated cardiovascular and all the other problems related to hyperuricemia, we should look at this problem at a more bigger picture. So we should treat the whole hyperuricemia syndrome rather than the joint itself. So because sometimes if the patients and also the physicians mainly focus on the joint, perhaps they think that it is not a very big problem. But then if we are thinking about reduction of mortality or reduction in cardiovascular morbidities or comorbidities, then perhaps there is a higher incentive or higher level of goal that we should achieve to the treatment of gout or hyperuricemia.
So is the adherence rate different by specialties?
I think, well, of course, I think so, because if you are general practitioner, perhaps you might focus more on other aspect of the patients, because usually for gouty arthritis, it will usually comes with all other comorbidities, metabolic syndrome, hypertension, renal impairment, diabetes, etc., etc. Then we don't really have time to focus on the treatment of gout. But then, if you are treated by a rheumatologist, then perhaps the perspective would be different. So we might be more concerned about the uric level and also the arthritis and the gout issues, rather than just focusing on other medical problems. So this might be having a little bit of difference.
How can SLS help patients to increase adherence or the disease awareness?
I think gout is probably is not just a joint disease. We should focus on very long-term complication comorbidities. This is a general disease affecting the whole body, like diabetes and hypertension. It is not just the blood pressure or the spot sugar level. It's about the other major organs, such as kidney, such as the heart, such as the brain. Okay, so when we are promoting gouty arthritis management, we should also focus, apart from the joints, also focus on other organs and the whole clinical picture, the metabolic syndrome management. And on the other hand, secondly, when we are trying to increase the patient awareness, perhaps patient educations and also their self-awareness is very important. So sometimes, like other chronic disease such as diabetes, you might consider other patient program to increase their self-awareness, like whether they can get some regular monitoring of the uric level, like some patient group on how to deal with the gouty arthritis and the other comorbidities. So this type of patient group would be very helpful to both improve the self-awareness of the disease and also to share their own experience, and also a support to maintain the drug compliance. And of course, in the physician aspect, we also have to improve their awareness of the treat-to-target approach, because if you just start the treatment without arriving at a very ideal target, then actually you are not treating the patient. So this point needs to be emphasized on the treat-to-target, like other disease entity, which is quite successful. For example, in patients with diabetes, you have a goal. In blood pressure, you have a goal, and then even in rheumatoid arthritis, you have a goal of a target. So this is something that that can be helpful for future management of the gouty arthritis.